Fantastic. And we are going to be doing our questions through Slido. So Eric, if you could please put the Slido link in the Zoom chat, and you can also get it from this QR code or by entering this number into Slido. We've disabled the Zoom chat for participants, so all of our communications will be going through the Slido today. So please have that open alongside the presentations. We're going to take all of our questions at the end. So we'll have our speakers present, and then we'll do kind of a roundtable conversation where we will incorporate questions that get entered into the Slido. Now to introduce our speakers. We'll start with Zeba. Zeba Khan is a doctoral student at the Endometriosis and Pelvic Pain Lab at UBC, where she researches how adolescents navigate access to care for period pain. She is also the founder of Free Periods Canada, a youth-led nonprofit advancing menstrual health equity through education, advocacy, and systems change. A Vanier and Killiam doctoral scholar, Zeba works across academic and grassroots channels to reshape how health systems respond to the needs of young people and those who menstruate. We also have Dr. Caitlin Borner with us today. Caitlin is a assistant professor at the University of British Columbia, where she leads a program of research in health equity and pediatric pain, focusing on gender and neurodiversity. She also provides care as a registered psychologist with the Complex Pain Service at BC Children's Hospital. Caitlin will be speaking about her work co-leading the Living Lab at Home with Dr. Tim Oberlander, which is a program of research aiming to increase the accessibility of health research across the developmental spectrum through co-design with young people and their families. We also have Madeline Barron with us today. She is a graduate research assistant with the Digital Health Innovation Lab at BC Children's Hospital Research Institute. She is pursuing a Master of Applied Science in Biomedical Engineering at the University of British Columbia. Her presentation will focus on her work developing a risk-benefit communication tool for donation of wearable and smart device data to research. So each presentation will give us each speaker will give us a brief presentation about their work, and then we'll have a roundtable discussion where we will take questions. And I will turn it over to Zeba to get us started here.
Wonderful. Thank you for that wonderful introduction, Haley. I'm just gonna go ahead and share my screen. Just let me know if you're all able to see the slides.
Yep, that
wonderful.
Looks good.
Thanks. Great. Hi, everyone. Well, thank you for this opportunity to share about our project, Period Pain is Real Pain. My name is Zeba Khan, and I'm a PhD student at the Endometriosis and Pelvic Pain Lab. My PhD research, as Haley had briefly mentioned, focuses on understanding young people's experiences of period pain and how they access care and treatment to manage their period pain. So today, my presentation will specifically be on how we developed a tool called Period Pain is Real Pain, which is a website and a social media campaign to promote that tool, and how we work together with youth researchers and clinicians to create that. So I was born and raised in Bangladesh, and I have been living in Vancouver for the past 10 years. I am very lucky to call this place my home, and I want to take a moment to acknowledge the stewardship of the Indigenous peoples of this land and recognize that the space that I occupy is the traditional, unceded, and ancestral lands of the Musqueam, Squamish, and Tsleil-Waututh nations. So period pain is a very common experience, with 6 out of 10 people with periods experiencing it at some point during their reproductive years. And for many people, period pain can significantly disrupt their lives, making it difficult to participate in everyday activities, sports, and in some cases, miss school and work entirely. Period pain is more than just cramps in the lower abdomen. And for a lot of people, it's associated with lower back pain, headaches, nausea, fatigue, and so much more. In some cases, it can also indicate serious underlying conditions, such as endometriosis, where uterus like muscle cells grow outside the uterus. Period pain is more common and very intense among adolescents, especially during the first couple of years of puberty. And we know that adolescence is such a critical time for developing academically, socially, and physically. So, when period pain prevents a young person from fully participating in their daily lives, it can have lasting consequences on their education and general access to opportunities. The good news is, though, there are many different things that someone can try to manage their period pain. So there's a lot of options for over-the-counter medications. There are wearable devices that can be used to manage the cramps. There are many different tools that someone could potentially use. But the data still tells us that many young people are experiencing period pain and are being held back from participating in school and other activities because of their period pain. So, why is that? One idea is that perhaps there could be better information out there to let young people know what their options are and also to help them recognize when they should speak to a healthcare provider. And this is where our project, Period Pain is Real Pain, comes in. This work involved the development of a website and a social media campaign where our goal was to validate those experiences of period pain and share information about period pain with young people. The website also features a period pain quiz, which was developed and validated by researchers in Australia. And this quiz, which is kind of like a BuzzFeed style quiz, gives you a period pain score of 0 to 5, where a score of 0 indicates that, maybe your period pain doesn't really bother you that much. But a score of 4 or 5 indicates that your period pain is moderate to severe, and perhaps you should consider speaking to a healthcare provider. One of the most exciting parts of this project is that this tool, the website and the social media campaign, was built together with youth, clinicians, and researchers all at the table. And I really want to emphasize that in our work, we made sure that youth were involved from the beginning. So we involved youth in helping us define period pain in their own words, and figuring out what do we want like the project to look like. And for the rest of the presentation, I will talk about how we were able to achieve that. The researchers and the clinicians were involved in this work as well, and their role was to help ensure that the content that we put out was medically accurate. But overall, the direction of the project was set by our youth partners. So this is a Venn diagram and my attempt to show you how all the different groups worked together. As you can see, there were distinct roles that we all played, but at the end of the day, we all kind of worked together iteratively and kind of went back and forth over the period of a year to develop the final product, which is the website and the social media campaign. One of the ways we worked with youth was by organizing a series of co design workshops over Zoom. So we invited 8 youth partners from across Canada to participate in these workshops. And for each of the workshops, they focused on developing a creative brief, describing what the content of the website will be, and what they helped us select what social media platform to focus on. In some of the workshops, they reviewed the early drafts of the website and provided feedback, which then our creative media agency partner, as well as the researchers on the team, helped address those feedback and leading to like the final product. And all the workshops took place virtually so that we could make sure the sessions were accessible to young people across Canada. This is just an example of what one of those workshops looked like and how we were making decisions. This is a snapshot from a Zoom whiteboard that we had created to share ideas and vote on the ideas. So, based on the suggestions that youth had generated in one of the earlier workshops, our creative media agency partner created two different palettes for what the website and the social media campaign could look like. So, in the following workshop, we brought it back to our youth partners and we invited them to share what they thought. And they generated these little like sticky notes where they shared their feedback and then they talked about it as a group. And ultimately, you can see that they all voted to go for a palette that was really bright and resembled like a retro 70s vibe. And we used this process called dotmocracy, fancy for just, using these little like dots of digital stickies to let us know what exactly they all wanted to vote for. And once we had our branding guidelines set by our youth partners, we invited an illustrator to hand draw 26 images for the campaign. And again, prior to this, the design, youth partners actually told us exactly what they wanted to see. They created a mood board where they showed us the type of images and the type of illustrations they'd like to see. And my job as the trainee on this project was to make sure all of this got communicated across the different partners working on this project. And then finally, our youth partners were also involved in creating the actual content for the social media campaign. In total, we created 31 pieces of social media content, and 19 of them were created by our youth partners. And on the right, you can see some examples of the content that our youth partners created for this project. Overall, this campaign was quite successful. We reached about 800,000 people in just a month, and that resulted in over 6,000 visitors to the newly built website, periodpain.ca. It was also featured across various media channels, including CBC. And we were invited to do over 5 CBC radio interviews and had 2 written articles published about our work. And on the day it was released, it was a trending topic on the front page of CBC's website. So, in a very short amount of time, we were able to reach like a big crowd. We have learned several things from this work. And the first thing is that the campaign was quite successful in reaching the audience that we wanted to reach. And what I mean by this is out of those who visited the website, 1 in 6 of the visitors completed the period pain quiz. And out of those who took the quiz, about 70% scored 3 or higher on the period pain quiz. And that means that they were experiencing moderate to severe period pain. And these are individuals who would most likely benefit from having access to a resource about period pain. So, this really tells us that the way we had set up the campaign, we were able to reach a large portion of the crowd that would benefit from having access to such resources. The project engaged 8 youth partners who played a central role in helping us shape this campaign and the overall project. And this group of young people remained very actively involved throughout the process, and they even expressed a strong interest in continuing to collaborate with this project and our lab in general. And so I believe, like reflecting on the project as a whole, I believe there were a couple of things that allowed us to generate this level of engagement with our youth partners. And the first one was that throughout this project, we created multiple ways for them to contribute and share their ideas. And what I mean by this is during the workshops, they were, of course, able to come together and discuss their ideas. However, there were also some exercises where they could work independently. They could look for images that help them communicate their ideas more visually. So we believe that by having a lot of different ways for young people to contribute in a shared space, it made it a little easier and more approachable for them to be involved in the conversation. Another factor that I believe that contributed to how youth partners were able to work together was the flexibility that we offered. So in this project, we had a lot of young people that were dealing with chronic pain, managing period pain on top of all of their responsibilities with school, which meant that there were times where they just weren't available to participate in those workshops. And we offered to meet with them one-on-one. We offered the option to share their feedback over email. We really worked with them at an individual level to make sure we're still hearing from them. We're still capturing their insights before moving on to the next step. And I really believe that this sort of flexibility helped us build trust with our youth partners. And as a result of this, they were able to remain engaged all throughout this project. And then some of the things that I've talked about so far are my reflections and anecdotes that I heard from the youth partners. It wasn't within the scope of this project in particular to conduct a formal evaluation of the co-design process, but I believe that if we were to do something like that, it would give us a lot of valuable insights into what the youth were thinking and how to make the co-design process better. And another question I often think about is who really gets to be a part of these workshops, especially when we are asking for a commitment for a number of workshops that are going to take place over a couple of months. It usually requires access to a computer, stable Wi-Fi, and since we are inviting young people who are dealing with chronic pain, it also requires them to be in a place health-wise where they're able to contribute to this work. So I don't really have a good answer for how to really make sure everybody can be a part of it, and I'm hoping to learn from the other panelists and our discussion overall. And I'm gonna, this is my last slide. I'm just gonna share a little bit about the next steps. So this campaign was such a fantastic opportunity for me to work with youth partners. And I plan to continue working with them as part of my PhD thesis. In the next steps of my PhD work, I will conduct one-on-one interviews with youth as well as healthcare providers to better understand their experiences of period pain care in Canada. And based on what I learned through these interviews, I will come back to this website and co-design additional features. And my hope is that I will follow a similar process, but hopefully based on the things that I've learned, I will integrate additional ways to engage with more youth and hopefully a formal evaluation process in the next steps of my work. We did produce a report where I have a lot more detail about the process that we took in terms of working with youth, as well as some more details about the social media campaign. I'll share that link in the chat if you're interested to take a look. So that's it for today. Thank you for your time and attention, and I will pass it back to Haley.
Awesome. Thank you so much, Zeba. That's fantastic work. And I think it's a really, really fantastic model for engaging youth and also just the awareness that you have around the contexts that these youth are living in and the way that they understand things, I think is really great learning for all of us. Okay, and I think we're going to pass it to Caitlin now. See Caitlin's screen. That looks good. All right, take it away.
Great. Okay, thanks so much. And I think Such a pleasure to speak after Zeba, who gave a really good introduction to the ways that that digital health tools and engaging youth in the creation of digital health approaches can be so important for supporting young people who live with pain. I'm going to talk a little bit about some work that we've been doing looking at a chronic pain population a bit more generally. And I've called this Connecting the Dots because really what we've been aiming to do is to help use youth's own data collected and delivered back in a digital format to help support their understanding and their self-management of their chronic pain condition. So if you think back to the last time that you saw a health professional about your pain, you were probably asked to rate it on some kind of scale that probably looked something like this. So a 0 to 10 scale. Maybe you were offered some pictures of faces. This is actually one of the most commonly used tools in pediatric pain research, asking children to identify the face that best represents the pain that they're experiencing. And this next reference might date me, but this is probably my favorite example of a pain scale. Obviously not research developed and validated, but I actually think probably speaks to young people more than some of our commonly used tools. But one of the challenges with all of these examples is that when we're asking young people to report on their pain experience, it's in a really static way. So we're asking them to tell us what is their pain experience like at a particular moment in time, or to summarize their experience over a longer period. And what happens then is we get these kind of single time point examples of, in this case, patient functioning. And it tells us sort of how they're doing in a particular moment or what their summary is over time. But if we actually look at the bigger picture and see what's happening in between those time points, often experiences like pain, this is also true for things like general functioning or mental health, are really variable experiences. And so part of what we've been interested in is this question of whether having access to data that shows some of this variability might help young people better understand what's going on for them. And our other concern about sort of existing methods of pain assessment is that it captures one aspect of the experience. So how intense the pain is, whether it's a 4 out of 10, an 8 out of 10, actually tells us very little about what the impact of that pain is. So the things that we would typically look at in the context of clinical pain care, like the impact on physical activity, the impact on social interactions, the individual's mental health, or other factors that we know to be related to pain experiences, like menstrual cycle, the weather, how somebody's sleeping or eating, if they're receiving any interventions. These things aren't typically captured when we're asking about a pain intensity measure. And then the other issue that we often run into is that there's a lot of populations that aren't well represented in pediatric pain research. And this is where, as a clinician scientist, I feel the most uncomfortable, because when I come in on my research days, I'm, all about using the evidence to make informed decisions, and I really believe in the power of research evidence. And then on my clinical days, I'd love to be able to use that evidence to actually provide treatment to our patients, and yet most of the patients that I see in clinic are not represented in standard pain research. And so then there's this kind of moral distress that arises from having a gap between who we're actually serving and who is being studied. So all of this has led us to an initiative that started during my postdoc with Dr. Tim Oberlander that we've continued on with, called the Living Lab at Home, where we've aimed to try and find different ways of collecting data in the context of child health research that has clinical applicability, that's accessible across the developmental spectrum, and that also allows for research participation from folks who are not necessarily on site or living in the lower mainland. And the aim of this is to really try and address some of those equity gaps that we see. And obviously, in delivering a more accessible approach to research, this kind of necessitates harnessing some digital tools in order to be able to do so. So as a really big picture overview of what the Living Lab at Home has involved, we had a lot of initial engagement work with families. We started off talking to families of young people with chronic pain, autism, cerebral palsy, and severe neurologic impairment, trying to capture a range of experiences in terms of medical, psychosocial complexity, mobility, communication, psychiatric complexity, and developmental profile. And we did a lot of initial family engagement about what would it take to reform the way that we're doing research so that you could participate in a way that feels meaningful to you and that would actually accurately represent your experience. We took all of that feedback from families. We incorporated some of it into a feasibility and acceptability pilot study of some of the methods that families had discussed. And then what we've now transitioned to is a cycle of more iteration. So updating methods based on the feedback that we've received, using that pilot data to apply for funding, and then continuing to implement some of these living lab at home methods into ongoing studies where we also have an embedded component of evaluation and patient and family engagement, so we can continue to iterate and update methods based on feedback. The Living Lab at Home is a much larger initiative, and I don't have the time today to go into the detail about all of the different components of it. So I want to focus specifically on one way that we responded to patient and family feedback and engaged in co-design to address some questions about how are we using the data that we're collecting for research purposes, and can that be harnessed in a way that can help support clinical management or self-management, and address some of those issues that I listed around how pain is currently assessed and conceptualized. So in some of our initial engagement work as part of the Living Lab at Home, when we talked to families from those 4 groups that I mentioned, so chronic pain, autism, cerebral palsy, and severe neurologic impairment, the results of our qualitative interviews with families and kind of asking them to think through some aspects of traditional research design and what does and does not work for them, we generated 3 key themes that related to the need for flexibility within the research paradigm, the desire for a reciprocal relationship with the research team, and opportunity and accessibility. And I'm going to focus specifically on the reciprocal relationship piece, because this is what led us to this particular digital health tool. But if you're interested in the other components, I would encourage you to have a look at the paper, which was published in the Journal of Developmental and Behavioral Pediatrics. So in terms of a reciprocal relationship, many families talked about how when they're contributing data as part of a research study, especially data that involves sort of repeated measurement and capture of these dynamic phenomena, that they thought that it might be helpful to be able to view their own data. So not just have the data go off into the void, received by the researchers, and then they never see it again. And families talked about actually, despite the fact that as researchers we're often good about translating the findings of the overall study back to families, that while they found that interesting, they also felt like it would actually be really helpful to be able to see their own data. And in our conversations with families, a lot of them talked about how this would help them to better understand patterns in their day-to-day experience. It would help them to zoom out and understand what a phenomenon looks like in a way that they have trouble understanding or really capturing when they're in the midst of it. But also offering, as this first quote illustrates, some of the concerns about receiving data back. And so what we really heard from families is that it would be so meaningful for them to participate in research if they could have access to some of their own data, but that this needs to be done thoughtfully and in a trauma-informed way. So this led us to this concept of using data visualization as an opportunity to harness this reciprocal relationship. So not just the patients and families giving us data, but actually being able to feed that data back to them. And the more we thought about it, the more we saw the potential for this to actually serve as a really important clinical tool to help enhance the data that we're collecting from patients at clinic visits, and rather than relying on sort of their retrospective report and memory, which we know is subject to all kinds of bias, but actually being able to capture in real time some of this lived experience data. So we ended up calling this tool My Week in Sight, and there was a much longer process, the development, than I have the time to talk about today. But Unma Desai, who was a master's student who worked with us and really led some of the key components of this project, wrote a wonderful thesis that details in a lot of detail what the steps were that we went through. But this was a partnership between researchers in the Department of Pediatrics and BC Children's Research Institute and the Department of Computer Science at UBC, and then with a very strong patient engagement component, drawing from both the work we've been doing in the Living Lab at Home, as well as some engagement from young people that we recruit specifically as part of this project. And we did some of this initial engagement work to find out, like, what would families want to be seeing in terms of the data that they would like visualized, what data do they care about when they're trying to capture their daily health experiences, and talking to a variety of interest holders, including clinicians and researchers, and even folks like math teachers to help understand like what ways can we visualize data that that young people at different developmental levels would be able to understand and appreciate. And we went through a variety of different versions of what this data visualization platform could look like, and then did some pilot testing and eventually integrated our first iteration into a platform with Care Team. And this is just a couple of examples of the visualizations. So we had visualizations related to sleep, where young people could see, based on the data that they inputted, it was updated in real time to show the duration of their sleep, the quality of their sleep. We also had data related to the intensity of symptoms that they experienced, what symptoms occurred, whether or not they took a medication for those symptoms. We looked at general functioning, social interactions, and a variety of variables related to mental health. And this is an example of how we integrated some of the data that's really relevant in the context of clinical care within this design. And this is something that families really responded to, which is what we called our expectation versus reality graph. So in the morning, we would ask them what they were the most concerned about happening that day. And then in the afternoon and evening, we would ask them whether that thing actually happened and how bad it was. And this is based on some of the principles of cognitive behavioral therapy, of the sort of testing out cognitions to see if there's a way that we can challenge some of the anxiety related to managing a health condition by displaying their expectations versus the graphs of what actually happened. So we did a pilot feasibility trial using this initial platform with 46 youth, where we had young people randomized to one of two groups. They either did just data collection alone for the first week, and then after a break, engaged in data collection alongside access to the visualizations, or they had the reverse protocol, so we could see whether there was a difference between their experience when they were just collecting data and inputting it and sending it off to the research team versus when they could actually see their visualized data. And what we found from this was that it was pretty easy to recruit our sample. Families were, keen to participate in this, and they were keen to complete their data entries. But there were a lot of technical issues that occurred in terms of the data that was inputted not always showing up in the visualizations. And then only half of our sample reported actually viewing the visualizations when they had access to them. Those that did view them said they thought it was really useful. They appreciated the opportunity for reflection, but there were also concerns about, the accessibility of navigating to that part of the platform, or knowing that it was there, or finding it difficult to interpret some of the visualizations, especially if they had a lot of missing data. So we took all of this feedback, we iterated, we did more engagement work, we switched to a different platform hosted by the Digital Lab. And we're now in the process of doing a pilot where we want to try and extend this specifically to autistic youth who have chronic pain. This is a group that's excluded from almost every clinical trial of pain treatment. And they're also overrepresented in pain clinics, and are a group that has a really difficult time with communicating their pain experience to providers because of the social communication differences inherent to autism, and the fact that pain assessment is a social communication process. So I have a wonderful student, Alyssa Wong, who's been working on this. This is like very early days. We've just started recruiting. We're hoping to do a small pilot trial with 8 participants, but so far we've had 2. And what we've learned from those families is that they really appreciate the opportunity to increase their awareness of the emotional and sensory components to their pain, and that seeing the graphs of mental health and sensory components side by side with their pain ratings really help them to appreciate those relationships. But that there's a need to further simplify our visualizations to help reduce overwhelm, particularly for this population. And we also got some really good feedback to the types of questions that an autistic population might find more sensitive. So for example, the question about social interaction was described as one that could be particularly triggering if they're having difficulty with social interaction. So more engagement work is clearly needed. And just to wrap up, I think the three main things that I've learned from doing this work is that it takes time, especially doing meaningful engagement takes a lot longer than I think our funding cycles would like and our publication cycles would like. But it really is important for developing relationships where people feel comfortable to tell you what's not working for them. I think doing this work well takes a willingness to fail, and I have considered this to be one of the projects where we've been failing forward. Like every time we fail, we learn something. And that wouldn't happen without having that trusting relationship with our partners. And that this partnership is really key. There's so many things that we didn't anticipate and that we couldn't have anticipated without having that really valuable perspective of lived experience. And I'll stop there. Thank you so much.
Awesome. Thank you so much, Caitlin. That's fantastic work. It's come a long way. Excited to see it continue and very much appreciate your attention to really including those populations that are less represented in research. And it's interesting to hear from your perspective as a clinical researcher how you're seeing that disconnect day to day. So thank you for sharing that. Now we are going to hand things off to Maddie. Your screen looks good. Please go ahead.
Awesome. Thank you. And thanks, Caitlin and Zeba, for those great presentations. I know I personally learned a lot already, and I'm excited for the discussion at the end of this. So as Haley introduced me, I'm Maddie, and I am a graduate student with the Digital Health Innovation Lab. Today, I will be speaking about a project that I have been involved in, which is the Health Data Donation Co-Design Study. Now, this is a project that we aimed to include adolescents in because we recognize that they are people that are collecting health data and they have really valuable opinions, and we wanted them to be represented. However, we did have a lot of challenges. So the next thing I'll discuss in my presentation is the challenges we faced in recruiting adolescents and some practical tips for hopefully overcoming that in your own project. And then lastly, I'll talk about our success with the co-design approach and how it helped us build trust with our participants. So to get started speaking about this health data donation study, just to provide some background, one thing that we know is that a ton of Canadians are using smartphones and smart devices. Now, these devices are continuously collecting data that can provide a lot of valuable insight into our health. So for example, they track things like our movement patterns, how many steps we take, how well we're sleeping, and even how well we're communicating, how we're texting, calling, etc. Now, empirical evidence shows that the donation of this data to research has many benefits. So one example is it enables the development of new digital health treatment options and also allows for the recruitment of large, diverse cohorts. However, right now at this time, this digital data remains relatively untouched by Canadian researchers, which is something we decided to look into more. So turning to the literature, qualitative studies show that limited public awareness and understanding, particularly regarding the value of health data sharing and the sensitivity of different data assets, remain a barrier to data donation. But when we look at the tools that exist and that are described in literature, they focus primarily on these technical specifications rather than meeting the end user's needs. So this was the gap that we hoped to address with this current project. So our goal was to develop a tool that helps potential research participants make more informed decisions about sharing their health-related data from wearable and smart devices to research. And in doing so, we aimed to identify some system requirements, develop a prototype, and then evaluate said prototype's usability. So the method we decided to use is the co-design approach, similar to Caitlin and Zeba. So just to quickly speak about co-design, it's a method that's iterative and collaborative in nature. So from an engineering perspective, it allows us to elicit system requirements based on the user's needs and then develop that prototype in collaboration with the end user. Now, there's many methods that you can take, but the approach that we decided to take was using focus groups. So we ran 3 phases of focus groups that included adult wearable device users, parents of youth who use wearable devices, and then researchers who are interested in this wearable device data. Now, as I mentioned, we had planned to include adolescents but faced challenges, which I will discuss at the end of my presentation. So we ran 3 phases of co-design focus groups in this study. The first phase, we led a guided discussion, which informed system requirements and our initial low-fidelity prototypes. In the second phase, we ran this co-creation activity where we shared these different low-fidelity prototypes or design options with our participants. And we asked for feedback on what they liked, what they disliked, how they would change things, and how they would place things. And one key learning for us there was that offering different choices and different design options actually led to the richest feedback because it kind of created this safe space for our participants to say, no, I don't really like that, but I like this a lot better, and I would change this one if it looked more like this. So that was somewhere we saw success, and the outcome of that was our medium fidelity prototypes, which we showed in the third phase of co-design and got feedback on to finalize the prototype. And then we also did an interactive survey where we used the Zoom poll feature to let participants respond individually and then held a group discussion. And that informed some scenarios for our usability evaluation. So quickly taking a look at some of the results. Across the study, we ran 17 focus groups, which included 24 adult wearable device users, 4 parents of youth wearable device users, and then 9 researchers, 2 of whom identified as healthcare professionals. And as you can see, we were able to recruit some adolescents, but where we struggled was in scheduling those consent discussions and obtaining consent. So unfortunately, we did not have enough adolescents to run a focus group, but we did see fairly good representation from the other groups, particularly the adult participants. So skipping over the results of each phase of co-design, at the end of phase 3, we developed what we were calling this risk-benefit communication tool, which is a smaller segment of a larger data donation app and is shown on screen. As I mentioned, this prototype was iteratively shaped and continuously updated by participant feedback, but after the 3-phase process, this is what we've landed on at this stage in the project. Our next steps and what we are currently working on is to run a one-on-one usability evaluation sessions with a new set of participants where we'll assess if this prototype is actually effective and satisfactory in helping prospective research participants make more informed decisions about sharing their data with researchers. So that kind of covers the project that we were running. Now, the next thing that I want to focus on is the challenges we faced when recruiting adolescents, because this is something we really struggled with for this study, and kind of speaking to adjacent researchers to our team is something we've heard others are struggling with as well. So the first challenge that we faced was with initial recruitment. Now, our initial strategy was to recruit by putting up posters in the Children's Hospital, sending emails to participants that gave permission to be recontacted that we believed would be eligible, and through Reach BC. For our adult population, we had really great success with these methods, but unfortunately for adolescents, we had literally 0 people sign up. So we decided to take a different strategy, and that was recruiting in person at the BCCHR Mini Med School. So this is an event, the session that we attended, that draws about 150 high school students from across the Lower Mainland. And here we saw much more success than by recruiting through posters. So I was at the booth and I had conversations with probably about 30 adolescents who were super interested in research and engaged. and wanted to participate. Ultimately, about a third of those, or maybe half of them, were eligible for the study. So at this point, it looked really promising for us. And the lesson learned here, and what I'd recommend to you, is to try to recruit adolescents in person. So whether that's at BCCHR events or in clinic or even at schools or through sports teams, this felt like the method that was most successful for us at this stage. Now, the next step is to send out the consent and assent forms and then schedule that consent discussion with the adolescent and their families before they can be enrolled in the study. So here, the challenge that we faced was we tried to organize all of this by email, and we had super low engagement and retention when trying to schedule these conversations. What I would recommend instead is to use texting to communicate with adolescents. And when we reflected on this ourselves, we realized that adolescents are texting to communicate. This is how they communicate with their peers, with their parents. So it only makes sense that this is how we would communicate with them as well. Another idea that was kind of thrown out by our research team, but we're not quite sure how this would work yet, is to maybe use social media. So working with younger students, we've noticed that a lot of students are communicating with each other via Instagram and Snapchat. So maybe if you have a lab social media, that could be an effective tool as well, but not quite sure how the logistics would work at this point. Another challenge that we faced was coordinating with both adolescents and parents, because we needed them both to be there for the consent discussion, and then we needed an assent form from the adolescent and consent from the parent. Strategies that we used and that I would recommend are to leverage group messaging, so including everybody in all of the communications, and just sending reminders and following up. In cases where we originally had zero engagement, oftentimes a quick follow-up would lead to that signed document or scheduling the meeting, which was helpful. So unfortunately for this project, we were unable to include them, but I do hope that with some of these strategies, it may be easier for the next set of researchers that is trying to do this. So I just wanted to end off speaking a little bit about how this co-design approach really helped us build trust with our participants. So at the third phase of co-design, both parent and adult participants shared how they really enjoyed seeing their feedback shape the final design, because it made them feel like their time had been valued and their opinions had been taken seriously, which I think is really important. Between the second and third phases, we had pretty close to 100% retention, which I think speaks to the value of including participants in this process of iterative research and design, because ultimately they're interested in the projects and they want to see that their participation was impactful. And that wraps up what I have planned for today. Just want to take a minute to say thank you. And I'm happy to answer questions along with the other panelists.
Awesome. Thank you so much. That's fantastic work. And I appreciate really going into the challenges of recruitment there, because I think that's definitely something I've also heard that a lot of people struggle with. So yeah, thank you for sharing that with all of us. I think, Eric, do you want to kind of get us started with our question and answers here?
Yeah, that's a good idea. So just wanted to first off say thank you, Zeba, Caitlin, and Maddie, for these valuable and really engaging presentations. I think I speak for myself, but likely many others, that your experiences are a really important reminder that although these are challenging processes to engage with sometimes, they're really critical for ensuring that the digital tools are going to be having an impact, and also just uplifting those voices that usually don't get heard in some of these research processes. So I just wanted to say thank you for that. So we're going to be moving to the questions section. So feel free to continue fielding questions from Slido, just using the voting option as well. But we're going to start off just by asking, maybe we've kind of touched on it a little bit, especially in Maddie's presentation as well, but just wanted to ask if you have some tips or suggestions from your experience that for researchers that are looking to engage with youth, what are some things that would really help drive success and maybe just learning about from your experience in that? Anyone want to tackle that first?
I can just mention quickly, I think one of the things that seems to make the biggest difference is making sure that you're actually asking a question that the young people care about. So I actually think if we go in kind of with a formulated idea in mind without having done some of that groundwork first, it's going to be so much harder to get the engagement because if there's anything that I've learned, is that the questions that are interesting to us as researchers or clinicians is not always what young people are wanting to know about. And so I think that initial engagement needs to have some openness to it to for the rest of it to be successful.
Great. Zeba or Maddie?
Yeah, I think that's such an important point, Caitlin. And I want to share that the project that I presented today, this is work that we did before my research project is starting. So in my work, youth were truly partners in helping us build a tool together. So that was essentially an engagement and partnership building project. And in my case, I would say that it was really helpful to make sure that there's very, very clear communication about how decisions are being made. So, for example, I had shared how youth had the option to vote and decide on what they want to see. If for some reason that was not feasible for resources, time, whatever the reason is, it was really important that we honor their decision and get back to them and tell them and be very transparent why we weren't able to pursue like a certain feature of the product that we developed, or why we are now considering a different decision, and giving them more opportunity to share any additional feedback. So I've kind of learned that that process of communication and really seeing youth as true partners in the work and as team members really helped us build trust. And I would say that that's like one of our key lessons from this work.
So for that. So I'd also like to ask another follow-up about just leading to success on this co-design. So so often like it's defined by the outcomes of the research rather than the strength of the partnerships and relationship building. So so has your research team explored ways to measure the success of the co-design process from the perspective of partners with lived experience? And do you have any thoughts or ideas on how this might be done?
Just get started. I have a very brief comment. A short answer is we weren't able to do that as part of the project that I presented today, mainly because of resources, time constraints, etc. But that is something that I'm really hoping to do in the next phases of my work. And there are a number of frameworks and strategies and ways you can assess and evaluate what the co-design experience was like for the participants. And if a formal evaluation is not possible, if I were to redo this project, I think one thing I would do is set aside some time at the end of each workshop, each meeting, or each interaction to really ask, how was that? How was that experience for you? Is there anything you would like us to change in the next meeting or in how we work? So really like creating these like small and very easy ways for the participants to provide feedback to the process, to improve the process. I think that is something I would do. I would integrate in my work in the future.
Great.
Just to add on to Zeba, similarly, this was something we were only kind of able to do anecdotally in our study. And something that we did was just kind of at the end opening up the floor and asking people, do you have any other comments about what we talked about today or your overall experience? But I am very curious, Zeba, if when you kind of implement this in the next phase of your research with a more formal method to see how that goes.
Awesome. And I think, thank you so much for that. And I think in our last minute here, we can switch over for some Slido questions. We've had a few folks asking about compensation. So were youth compensated? How did that work? Any thoughts on that?
Yes. Always.
Yeah.
Like it's so important. And it's something that I don't know if I'm like allowed to say this, but like something that our institution doesn't always make that easy. But it is so important. And that's part of the reason why we have thought about a lot of our work as having an iterative quality to it. Because I see there's also another question about funding the engagement pre-research, and what we've been trying to do is to find opportunities to do that at the tail end of a previous project to inform the next project by sort of embedding it in the design. This obviously is more feasible when you've got a program of research where each project is building on the last, but it's critical. And I think like ethically, it's we're all getting paid for the work that we're contributing to this research, and our youth partners should be too. And that also helps with the just actually having the engagement is showing, appreciation for their time in that way.
Awesome. And I think if everyone's okay, we can take maybe one more Slido question, but I totally understand if folks have to jump off to their next thing. One more question that came in is, can you elaborate on how youth partners were selected? What was the criteria? What were the age ranges? So curious to hear really anything that, any thoughts that you had around setting those criteria for the youth that you would include in your work.
Happy to answer that. I saw that question pop up after my presentation. So for our work, we had put out an open call that was shared on social media with a poster, and we invited anybody in Canada between the ages 15 to 20 and anyone who has experienced period pain to express their interest in participating in the co-design project. It was a very simple form. Again, this is not a research project, so our forms and the information we collected was only was just questions that would help us identify if they lived in Canada, if they like how interested they were in actually participating in this work. We had one question that was open-ended where we asked about any lived experiences that the youth wanted to share, that kind of like frames how they think about period pain or how they experience period pain. So we had about 127 people, youth, that were interested in joining the workshops. And one of the reasons I believe we were able to reach that many youth was we had contacted youth service community organizations, so nonprofits that work with youth, and we had asked them to share the social media posters on their channels and whatever they felt comfortable with. So that helped us reach a lot of like younger people through like the social media process. And in terms of actually selecting them, we met with our youth partners one-on-one before we selected them. So we had narrowed it down to about 15 youth partners that we wanted to talk to. One of our team members and myself met with them on Zoom, and we were considering the location, of course, the age. We were considering lived experiences that gives them a different perspective. And then we were also considering wondering how would they work together? Like, we're bringing young people together in a shared space where they're going to be talking about periods, which is such an intimate topic for a lot of people. So we really wanted to make sure that the youth group would also be able to work together. These are not like, very concrete criteria that we were using, but these are kind of like the steps that we took to select the youth partners for my project.
Awesome. Okay, I think it's probably about time to wrap up. Thank you so much to our speakers for being willing to share their experience and their perspectives. It was really valuable to hear about your work. And I'm hopeful to see all these projects continue. And thank you so much for everybody who joined us today. I really appreciate you taking the time. And as a reminder, these are recurring seminars, so please join us again in June. We will have a seminar on commercializing research, so should be a good time. And feel free to email me with any questions or follow-ups from this. I'm happy to connect you with speakers if that's something you're interested in. Yeah, so thank you so much, everyone. Really appreciate your time today.